Hi, welcome to Smarter Athletes number 4. This course is on injury management principles, and we're also going to talk a lot about injury management from the standpoint of prevention. In fact, that's where we're going to really focus because, for the most part, when it comes to the interest from an athlete in injury prevention or injury management, rather, we're looking at what we can do to prevent things from happening that have either occurred already or things that we're a little bit more vulnerable to because of our predisposition, whether that's biomechanical, the way we move, or it's based on the risk involved in the sport and the position that we play. So, as much as we use the word management, we're going to speak mostly to the idea of prevention and what we can do as athletes to build better ancillary capacity, better knowledge about how we work to prevent injuries, the ones that are preventable, and in fact, most of them are. So, our targets here are making sure that we can understand how building better strength has a role in the sake of injury prevention. And then, if and when we do succumb to any kind of sport injury, we want to understand the different positions that exist inside of sports medicine. And then we want to look at keeping risk of injury low with things that we'll refer to as maintenance work. And again, that's going to kind of touch back on strength and conditioning. And then lastly, we're going to talk about recovery and rehabilitation. So again, we're looking at strength work there in that particular situation. It is from the unfortunate side of having dealt with an injury already and what the road to recovery looks like in terms of getting back into the game and using rehabilitative strength work and some of the rehabilitative sports medicine that is available to us to make sure that we're on the right track. So that's kind of how we're going to break this one up into 4 separate parts. And we're starting with part 1, reducing risk of injury. Okay, so when we look at the sports science side of this, injury management is a massive business, and it's also a big subdiscipline in sports science. There are tons of jobs that kind of all rely on athletes getting injured, and injury is a fact of life for an athlete. There are 0 athletes I know who go through their entire athletic career without dealing with injury at one time or another, and in more cases than not, multiple injuries over the course of an athletic career. So, more than ever before, though, professional sport organizations are spending money and resources on people that are not just there to help athletes return to optimal health, but keep them healthy in the first place, keep those injuries at bay, keep them away, and that's actually my job too. I think if I take up all the different roles that I have, as a strength and conditioning professional, number one is looking at the athlete with respect to their vulnerabilities or their predispositions to injury, and making sure that we can mitigate risk at least as much as possible. So, who are the people that are doing this work? Of course, there are people like me, but there are also athletic trainers, there are athletic therapists, physical therapists, there's kinesiologists, sports science and management staff, sports medicine doctors, people making way more money than I do, and they run the gambit when it comes to injury management. So where we're going to start here is kind of dividing athletic injury into 3 different categories, and this is really just for our intent and purpose today, to make sure that we can understand how to categorize an injury and how to maybe assess the risk of an injury. We'll talk about chronic injury, we'll talk about acute injury, and then we'll talk about something called acute on chronic injury, which is actually quite common. Starting with chronic injury, this is an injury that's caused by a repetitive physical stress. So, a chronic injury is something that is usually involved when poor mechanics are happening, or poor movement patterns are happening, or there's just really high training volume, and the body hasn't really had a chance to adapt to that level of training volume. And maybe there's insufficient rest in between training sessions, and it's just too much shock for the system to endure. All in, we're talking about something that's not caused by one incident. We're talking about an injury that's caused by a repetitive stress, and it's gradually built up to a tipping point of injury, right? Oftentimes, chronic injury is caused by a combination of what you see on the screen here. It's usually not just one reason, and a lot of these, as you can imagine, go hand in hand. When we talk about acute injury, this is the opposite. This is an injury that is caused by a single and usually a high speed or high velocity movement. It could involve contact or a collision, but it could also be classified as non-contact. Sometimes we see an athlete land in a faulty position or a really awkward position, and we see a knee joint or a hip joint or an ankle joint move in a way that is definitely not normal. And when we break that down or we look at it in slow motion, we can see the cause of that injury happen right at that exact moment. It's also more likely to involve damage that would require an intervention. So something like a surgery or a casting, somebody that needs to really diagnose it and get in there and say, we have to immobilize this joint, or we actually have to cut this open and do some repair work here. Unfortunately, it's an acute injury that's going to be more likely to involve that outcome. And then lastly, it's something that in the event of a non-contact circumstance where there's not a collision, it's likely the result of poor preparedness, right? When an athlete is not prepared. And this is something we'll talk about a little bit later when we speak to the role of strength work. So when we talk about injury prevention and the possibility of an injury being acute on chronic, this is where we really, really can look at the role of prevention. And I'll speak to that a little bit more in a minute. An acute on chronic injury is exactly what it's sounding like here. It's most often the result of one final event. So yes, there is one instant that we can identify and say, yes, that was the time that the injury was caused at that very moment. But that event under normal circumstances wouldn't have happened. And the only reason it did happen was because there was this chronic buildup of repetitive stress and under recovery and poor mechanics, or all of the things that are the causes of chronic injury led to this kind of final moment where we use this analogy all the time. There's kind of the straw that breaks the camel's back, and there is that one critical instant that is a little bit too much overload, and the result is the injury. And in these cases, we can be talking about something like a cruciate ligament tear, but we can also be talking about something like a stress fracture, where something is chronically getting stressed out a little bit too much with respect to how much recovery is being offered after each workout, and it's not the first or the second or the third or the fourth workout, but maybe it's that fifth or sixth workout with so much impact and so much repetitive stress and not enough recovery afterwards that the athlete's bone succumbs to a stress fracture, right, after one final hard landing that was performed after pulling down a rebound or something like that. And that's the example I give here, but you can think of others, I'm sure. Now, so when we talk about injury prevention here and reducing the likelihood of injury, we want to observe injuries as either acute or chronic, since the strategies that we use to reduce the likelihood can be applied, right? So we want to look at, like, okay, well, what's the likelihood of an acute injury like an ACL tear in a soccer player? Okay, and we look at the instances of that injury and how an athlete might succumb to that injury, and then we say, okay, well, what muscles are involved in decelerating properly or stopping and changing direction properly, so that maybe we can build a better tolerance or a better risk reduction load there, so that we can actually, in all likelihood, prevent that from happening, right? So we want to look at the role specifically, and we want to look at what the cause of the injury is specifically, and then we want to say, okay, well, how can we mitigate that, or how can we slow that down? How can we reduce the likelihood? And so by reducing likelihood in chronic injury, we want to say, okay, well, what are the repetitive stresses? And what are the musculoskeletal structures that support those stresses? All right? Are we talking about a chronic injury to the knee? Okay, well, what are the musculoskeletal structures that support the knee joint generally? And how can we better understand that maybe by building up some better muscular endurance and tolerance around that muscular structure, could we then reduce the likelihood of injury to that joint caused by repetitive stress? So if we improve levels of muscular strength and muscular endurance in that same musculoskeletal system, we're going to have a pretty good likelihood of reducing the chronic stresses that build up and result in that chronic injury. Okay, so if we look at these three examples here, we've got a pitcher who's obviously doing a high velocity movement, but it's a repetitive movement. We're talking about 100 repetitions over the course of a game, right? We've got a distance runner in the middle, or a marathon runner, who's, over 42 kilometers, taking probably somewhere close to 42,000 steps. And we've got a basketball player who is running up and down the floor, landing hard, and probably taking quite a bit of contact, but it's not just one or two contacts per game. All right, so in all three of these cases, very different cases and very different movements that are chronic stresses themselves. they're all repetitive stresses, and that's the key thing to understand here. So reducing the likelihood of those chronic injuries involves taking a different approach per athlete, right? So what are some of the other influences that might reduce or increase likelihood of chronic injury? We're also talking about things like recovery, sleep, and rest. So it's not just strength work, but we're talking about getting enough sleep. When we sleep, there's a lot of processes that are happening at full force when we sleep. One of them is called osteogenic response, and that's quite literally bone rejuvenation. The health of our bones and the resilience of our bones to things like stress fractures depends on that response happening when we sleep. It's also helping, obviously, with overtraining and fatigue. Getting enough sleep and getting enough rest is crucial to managing overtraining and fatigue, and we can see that. We can see that when we compare ourselves to pro athletes and we say, well, how can I be overtraining with only 12 or 15 hours a week of training volume, but somebody like LeBron James can train 30 hours in a week and not be overtraining? That doesn't make any sense. Well, it does if we apply the amount of recovery and the amount of sleep and the amount of rest that we are able to manage and the amount that somebody like a professional athlete is able to manage. We're talking about somebody whose full-time job is just to be an athlete, and the rest of the time they can be working on their recovery. Compared to somebody else who might have 30 hours of school each week. Maybe they have a part-time job. Maybe they have a full-time job. Those things kind of stand in the way of being able to kind of cover yourself, or pamper yourself, I should say, with enough recovery, sleep, and rest. Second variable is, of course, nutrition and hydration. So we talk about dehydration or nutrient deficiencies. These are some of the most common causes of long-term stresses that lead to injury. And dehydrated muscle is less elastic. It doesn't work nearly as well. And we all know what a dry elastic looks like and what happens to a dry elastic when we kind of pull it to its maximum tension. It's far more likely to snap and tear than a newer elastic that has a lot more, I just want to say, flexibility in it, and a lot more bounce and a lot more spring in it. When we talk about program design, this is a big one, and a lot of the time it's as simple as too much volume prescribed to the athlete. And again, we can go back to that example of what too much volume for one athlete is compared to too much volume for another. The overprescription of volume and intensity in a program can be the absolute worst thing for increasing the likelihood of an injury to an athlete. And this really it's common sense for people like me, and for other people it's something they don't really look at until they're hurt, and they say, well, I downloaded this training program from this website and this other guy used it and it really worked for him, so I'm going to use it too. And the difference is you've been strength and conditioning for 1 year, and the person who uploaded it to the website and had all the success and healthy results from that training program, they've been working out for 7 or 8 years. And so in one of those cases, it's a perfectly appropriate training load. And in the other case, it's way too advanced and it's way too much volume and way too much intensity. Another one is biomechanics. And this is when we're talking about movement patterns, how well the athlete moves. And this can be as simple as something like running. We look at an athlete's running gait and how their heel strikes the ground when they run, and what kind of flexion angle is happening at the knee and the hip and the ankle, and how much shock is being absorbed. And what those joints are basically taking on with respect to load. And in some cases, when there's poor movement patterns happening, there's far too much stress on the joints involved. And without that being corrected, we're putting ourselves at a far greater risk of an injury in the long term. All right. And now these are just some of chronic injury prevention variables. There are so many others as well, but this would be a great place to start. If we were serious about taking the likelihood of our injury down as low as we could, this would be a great place to start. In addition to having a really good preventative maintenance program when it comes to strength and conditioning, looking at these 4 variables here, and making sure that you're taking all of them seriously. When we were talking about reducing our likelihood to an acute injury, we really want to start looking at the high-speed movements that are involved in our particular sport and our particular position. And then we want to look at some of the injury trends that are happening at the professional level. And we can look at people who play our sport and play our positions at the professional level, and we can see some of the most common injuries happening. We can see the ACL tears in basketball players and soccer players, and the Achilles tendon ruptures in sprinters and basketball players. And when we see these things, we wonder about what's causing them. And a lot of the time, these injuries are what we referred to earlier as acute on chronic. Sometimes they are under recovery. almost always there's a high speed movement involved, whether it's a sprint or a jump or a landing or a deceleration or a change in direction. But from these kind of observations, that's when we can start to look at how vulnerable we might be as athletes ourselves. And when we look at these three examples here, what are some of the ways we know we can reduce likelihood of acute injury? Now, I think the one that's probably the most famous of these three, and I probably don't even need to say it, is that example on the far right. It was about a year ago today that we saw this happen, and we wondered why did that happen. There was a lot of speculation around why that happened, why that Achilles tendon ruptured, and for the most part, people saying, well, this was a chronic injury, and this was a player who probably shouldn't have returned, and did return because they were in a pretty dire situation with respect to needing to perform well. And this particular player was, somebody who had a lot of stake in whether or not this team was going to be successful. And when we look at all of those things, we say, well, this was definitely something we could classify as an acute on chronic injury then. This is somebody who kind of prematurely returned, and as a result, there was an Achilles tendon rupture, simply because we were asking a joint to do a certain amount of work at a certain intensity, a certain velocity that it was nowhere near prepared to do with respect to being recovered from an initial injury caused by too much load. If we look over to the left, that's likely going to be an ACL tear. We look at that right knee happening there. And we see what's called knee valgus, that knee kind of taking on so much load, moving inward. That athlete's likely wearing cleats, so she's likely spiked into the ground, and that knee does not want to move that way. So we're asking that piece of connective tissue that basically works between the femur and the tibia to get super long. It's not capable of getting that long, and it's in all likelihood going to tear, either in full thickness or in partial thickness. And in the middle, we're probably looking at something like maybe a potential shoulder dislocation, being in that kind of a locked arm position, full weight bearing, and maybe moving in kind of a rotational capacity with a whole bunch of force. In all likelihood, we'll see something like a shoulder subluxation in a sport like that. I'm not saying in that exact picture, but in a situation like that is the fairly decent likelihood of it. So when we look at reducing likelihood, again, the variables aren't changing. That's interesting, right? When we talk about reducing likelihood in these cases, aside from strength work, what can we do to make sure that muscles are prepared, right? When we talk about program design, though, as a variable, we're talking about making sure there's a really, really good warm-up. And we're talking about that joints are prepared to move in the way we're about to ask them to. Right? When we talk about nutrition and hydration, we're not talking about dehydrated muscle and deficiencies. We're talking about what are the specific micronutrients that play key influences on soft tissue and their vulnerabilities to injury. So what are some of the things that we need to make sure are in our diet so that muscles recover well and muscles perform well in their most elastic state? Right? When we talk about recovery and sleep and rest, we're not just talking about getting enough, we're talking about alertness and awareness, because so many of these acute injuries are happening when an athlete's not necessarily having that narrow attentional focus. There might be a little bit of a slip there in terms of attention to detail or their sport-specific role. And when we're talking about biomechanics down at the bottom, we're talking about technique. In a high-speed situation, there's no room for poor technique. So when we're talking about sport-specific movements that involve a ton of speed, right? Any sort of flaw in movement or technique is a drastic increase in the amount of risk that you're carrying with you. So while the categories are the same, recovery, sleep and rest, nutrition, hydration, program design, biomechanics, the ways those categories are influential are slightly different, or at least there are some new things to consider there. And that's the end of part one. Hopefully that gives us a pretty good introduction to understanding acute versus chronic and acute on chronic injury. And we'll get ready for part two, where we start to look at some of the other variables that are involved in sport injury and some of the roles in sports medicine. Thanks for watching. As always, you can reach out to me by email. My address is up on the screen there, or get in touch with me through the site, strongerbcss.ca.